use of diagnostic tests is becoming more and more prominent in modern healthcare solutions. Tests developed by the biotech and life sciences sector allow us to identify medical problems at an early stage.
A good diagnostic test is analyzing in detail the knowledge about the disease and uses this knowledge to develop a precise and accurate measurement of the patient's health situation. This diagnosis allows the doctor then to make the right decisions in terms of diagnosis and in terms of treatment. And an early diagnosis allows the doctor to prevent a number of unnecessary treatments for the patient. And as a result of that, you achieve a much more direct and a lot more personal treatment of the patient.
In Flanders, 250 companies are active in the life sciences and biotech sector. Roche Diagnostics is one of the largest players worldwide and is also active in Flanders, in Vilvoorde.
In Belgium we have 165 employees and 2/3 of them are having a background either in life sciences or in engineering. To bring a good test to the market, you need to have a test which is highly automatable so that the doctors can get the results back quickly. So our engineers here in Belgium help the laboratories to set it up in a way that the workflow is very efficient. And second, you also need a high value test. It means the answers that the test is providing have to answer a very relevant medical question. For example, our HPV test helps you to determine if you have a virus that is causing a cervical cancer much earlier than the tests that we are using right now. With the advances in science and in technology, diagnostics is no longer just a stepping stone in treatment, but it is a key enabler to build a high-quality healthcare system.
Each year, between 20,000 and 30,000 Belgians suffer a concussion, a mild traumatic head injury, usually after a fall or a traffic accident.
A mild traumatic brain injury, when we are dealing with trauma to the head, after fall, for example, and those patients may display some kind of loss of consciousness for less than 15 minutes, having some retrograde amnesia for almost 1 hour, and some of those patients may display some kind of vomiting and headache as well.
More than 90% of patients undergo a CT scan in order to examine whether there's any possibility of brain damage. It's striking that only 5% of them actually have brain damage. An alternative for the CT scan is a blood test that measures the amount of S100 beta in the blood. S100 beta is produced by cells in the brain.
Your head is hit by a fall or by a concussion. Then this protein gets released into your bloodstream and then you can actually measure it there. And so this is a very good indicator for your doctor if he measures S100 beta in your blood.
We have now at our disposition the S100 protein, which can be measured in the bloodstream. And if the results are negative, we might be quite sure that there is no brain damage what will be shown on the CT scan.
So in fact in Scandinavia the S100 test has already been integrated into the medical guidelines for diagnosing a suspected brain injury. So you first do a blood test for S100 and that helps you to avoid unnecessary CT scans because a CT scan uses radiation and radiation can be potentially harmful for your health. So if you can avoid it by ruling out a brain injury first with a blood test, it's a good way and it's also a very beneficial way for your healthcare system.
Nearly 30% of unnecessary brain CT scans could be avoided through the combination of examining external signs in the patient and the determination of the protein S100 beta in blood serum. The new method also saves healthcare costs.
Well, the S100 is an interesting test because in patients with a mild brain injury, if we apply the test first, then there is a big potential for savings. About 300 to 400 euros can be saved for the health insurance per patient, and on the country level about 7 to 8 million euros.
For the patient, he will be able to be cleared for the emergency department as soon as possible and not be able to be observed for at least 12 to 24 hours at the hospital. For the hospital as well, that means that we will have more beds available for those who need it more.